Hey, folks, just getting situated here, so give me 2 seconds. This is episode number 2, Mara.
It is.
Hey, folks, just getting situated here. So there we go with that. All right, we'll see who pops in tonight. Mara we both sort of made this up on the fly to do a Monday night show, so we'll see who's around. And we already have a bunch of questions left over from the last show. We'll take some live ones tonight. So we'll see who pops in. What if no one pops in?
We'll still have a show.
Will we?
It's fine.
All right, let's see what happens here. How'd you make out today, right?
Yeah. What are you doing?
I'm situating things
Okay.
so that I can follow the live chat if there is a live chat.
Did you announce it?
Yeah, but the problem is I announced it on the community tab, you know. So let me hook it up on this page too. Videos here.
Hi, Amanda. Amanda's on.
Hey, Amanda, how you doing tonight? Good. Welcome. We're just getting situated here, so people must be getting the notifications now that we're on live. And Mara and I are doing episode 2 of whatever the show was called.
We haven't decided yet.
Yes, I call you the Good Doctor, but we'll see what happens. Gloucester girl, how you doing, Rena? Good to see you.
I think, didn't Amanda have a question? You should ask her first since she's here.
We have Amanda's. I have it with me. Let me do this and this. I'll need this. So a few announcements are, I'll probably be on live tomorrow night for a bit to do a live question gathering session for a net show. So I'll be live for questions tomorrow night. We'll figure out what time that is, probably 7 p.m. Eastern. And then I'll be on live with Annette Wednesday evening, probably 6:30 or 7 p.m. Eastern. The reason why Mara and I are inside tonight is because the weather's lousy. It's about 98 and humid out there and rainy. So we're indoors tonight, unfortunately. But it's been a great run of weather here too. Yeah. So then question gathering Tuesday, Annette Wednesday. I think Thursday morning, first thing, I'm actually chatting with Linda Sabo. She's a hypnotherapist. And so I'll do that interview the same way I did with the author, Susan Wadia Els. I'll record that. I'll have maybe a premiere video that'll play either Thursday or Friday night. I'll sit in during that so I can engage with all of you folks and then see if you want a subsequent interview. I know people did want one with the author about for busting breast cancer, which was cool. I really think you guys are going to dig the hypnotherapist. I met her for the first time last week. I was like, yep, this is going to work on the channel. So anyway, that'll be Thursday evening or Friday evening. So it's a full week of stuff here on Bridge Cape Bam. Anna Lee, good to see you. Hi, Libra lady. Rosemary. Mari, how are you? Oh, Jack had conjunctivitis.
Yeah. It certainly could be allergies too, though.
Hi, Giselle. How are you? Good to see you. Okay, so do you want to start getting into questions now, Merritt?
Yeah.
Okay, do you want to start off with Giselle's here since she just popped in and asked? Hi, Judy, by the way. So Giselle asks, why do some dog breeds get esophageal collapse? Can we do anything to prevent it?
I don't know if you mean tracheal collapse. Esophageal collapse, I can't say I've heard that specific term. You probably mean tracheal, which is the airway, the tube that leads from the oral cavity or back of the throat down into the lungs. Small breeds are much more prone to it, especially toy breeds, Maltese, Poodle, really tiny dogs. There's really not a way to prevent it, unfortunately. It's just that narrow, already small to begin with trachea, and sometimes with age or that it can start to collapse down or just not stay open consistently, and it usually causes a cough. So no prevention. It tends to be fairly minor, more of an annoyance than anything. But yeah, sorry, no prevention.
Are you done?
Yeah. Yeah, I know. That was quick.
That was a quick one. Okay, Mariette asked us the last time around. This question: are boosters really necessary for dogs?
Oh, and she's in there now.
Yeah.
Hi, Mari.
Right. Or can I have blood done to check?
Right. So yeah, we can talk a little bit about vaccines. Of course, there are certain vaccines that are highly recommended, in some states required for dogs and cats. Where we are, Massachusetts, for instance, does require rabies vaccination for all dogs and cats. There can be exceptions, but they have to be dictated by the veterinarian. So as far as doing titers with rabies, that it's super expensive, one, because there's only one lab in the country that does it. They usually do it for international travel. So it's, pretty costly. And there would be debate about if, say, you did have even if your dog had a good titer for rabies, but they bit someone or another dog, would they still have to undergo quarantine, et cetera? So there's, a lot of difference of opinion on that. So certainly for rabies, I recommend just getting the boosters. It's initially a 1-year vaccine, and then it can go to 3 years in most states, depending on the vaccine used as well. For the other vaccines, certainly distemper parvo is the one that most commonly, people would seek a titer as an alternative. Again, maybe some boarding kennels might not accept the titer as an alternative. If your dog's low risk and not going to kennels, then certainly I would inquire with your vet about doing a titer rather than a vaccine for distemper parvo if they're low risk. If they're high risk, going to boarding kennels a lot, around other dogs quite a bit, then, there's just maybe not 100% agreement on whether titers actually do mean that disease prevention is present. Yes, it should mean that, but with something as severe as distemper or parvo, if they are high risk, I still would recommend the vaccine. As far as vaccines go in general, my big spiel or my soapbox I get on for that is that hopefully your veterinarian doesn't just do one plan where dogs get all these vaccines. It doesn't matter what their lifestyle is, what their risks are, what their age or anything. They just, nope, they need these vaccines. I really hope that's not the case. I hope that they're looking at the risk to your pet and the lifestyle, of your pet, the history of your pet as well. So by that, I mean, if there's a history of vaccine reaction or autoimmune diseases or something in that regard, then really they should be tapering back on the vaccines that they recommend for your particular pet. And then where you live as well, where we are, of course, Lyme is huge. So, a dog that goes out into the woods hunting and is going to be more prone to ticks. Definitely that dog, I would talk about giving a Lyme vaccine, but that a dog that, walks around in the owner's purse and never touches the ground and doesn't live in a tick endemic area, we're not going to, discuss Lyme vaccine. In fact, when I worked in California, we didn't even stock Lyme vaccine because we just didn't have a tick issue out there. So my biggest, again, soapbox thing on that is just hopefully your vet tailors your animal's vaccines to your animal and doesn't just say, no, all dogs should get all 6 vaccines that we have, no matter what. And cats as well. Cats that are indoor only, certainly less risk as far as getting a feline leukemia vaccine. I might not, recommend that for an strictly indoor only cat versus a cat that goes outdoors. So just trying to tailor the vaccines to lifestyle, location, risk factors, especially with, the negatives that vaccines can cause in certain pets. So.
Can I tell you, so I've never even heard the word titers before. What is that?
Titer, it's a blood test where you're checking to see the amount of antibodies that are in the bloodstream. So in theory, it means that when you give a vaccine, your immune system should produce antibodies that are that are protecting you against the virus. So the titer is a number that says that you have a certain amount of immunity. And, if you're over a certain threshold, that's where you can say, yes, your immunity is still there. You don't need a booster, but there still would be reasons why I would think about giving it.
Gotcha. So Mary thanks you. She says that's my concern about history and location.
Oh, yeah.
Shots. You are so appreciated.
So Mari, definitely, if you have a vet who just says, nope, all dogs should get rabies, distemper, Lyme, lepto, bordetella, influenza, I don't even want to talk about your dog's risk factors, I'd probably go to someone else.
And there you have it. Okay, thanks for the question, Mari. Dorothy Lynn is in, Mary, and she asks, are there any supplements good for cat's fur?
As far as like helping with matting or just helping with the health of the coat, fish oil to me is the best supplement for coat health. You can find it in a lot of different forms. Sometimes it comes in a little in a liquid form inside, with a pump that you just pump onto the food. It can come in capsules as well, where you would just maybe puncture the capsule onto the food or try to give it right to the pet. But yeah, fish oil can help with dry skin and just the luster of the coat. That's the main one.
Fish oil.
Yeah, fish oil.
That's big around here too. We have a lot of our friends that are fishermen. They save up skins and everything for pets.
Actually. And it can help with other things too, but this specific question as far as coat, fish oil is always the first thing I think about.
Yeah. So if you're just tuning in, I'm Corey. Hi. And she is the good Dr. Lockwood, an actual real life veterinarian. And she is answering your pet care questions. We've done this once before. It was great. We think this will be some sort of regular or semi-regular gig that you do, Mare.
Yeah.
Right?
Yeah. I enjoyed it.
So there is that. So if you have questions, fire them our way. I have a bunch here too, left over from the last show that we want to get to as well.
I have trouble with where to look because honestly, I'm looking at Corey on the screen in front of me.
Yeah. Well, most people can't take their eyes away
from
me.
Exactly.
This is how it works.
So if I'm not looking, I know. It's just weird to look at a little dot when I can look at you.
All right. Let's see. This is from Susan Johnson. And Susan asks or says, my dog sprained his tail while swimming.
Oh,
do you think he over-exercised or the water was too cold? I've kept him out of the water since this happened.
I would guess, just a guess, of course, that it was more over-exercise than the cold. It's called, actually, there's a name for it. It's called happy tail.
Oh, yeah?
Yeah, a dog can injure their tail just because they wagged it too much. We're too excited, too happy.
How has this one never done that?
Well, he's got a very strong tail.
He's got a huge tail.
But yeah, it's hard to treat because you have to stop them from wagging their tail, basically.
Oh, wow.
Good luck.
Yeah.
So you just kind of stop excitement and try to control it as best you can. And anti-inflammatories and pain relief can help too. Sometimes icing, that kind of thing. But I would think it was just more overuse than the cold water. I don't think cold water would have affected the tail. Yeah. That's just my guess.
So there's that. By the way, the current poll question is, where's Bubba? Is he sleeping or is he napping?
He's right behind us.
But he's actually, I would say napping.
You can see the middle part of him right down there, but that's
the middle of Bubba.
I can't do this. There's his head. That's Bubba.
That's him. So, and the funny thing with Bubba is he can hear us. His eyes are open and he chooses to ignore us if we are ignoring him. Yeah. So he gets very pouty.
If we said certain words, his head would pop right up now.
So Joanne Stein says, isn't napping the same as sleeping? And no, Bubba, he has many sleeping gears.
Yeah.
He can employ. So there's that.
Heavy sleep.
Okay. So Joanne Stein also asks, is pet insurance really worth it?
I guess if you have unlimited resources where if your dog or cat or pet, whatever species, had a sudden major life event that was going to be, several $1,000s or very expensive to treat. In cases like that, I do think, pet insurance is helpful to defray the cost of those major emergencies. I haven't really compared or looked at the cost of programs in a while, but programs that you just have wellness care, I personally don't think those are necessarily a good thing, just because by the time you pay the premiums of the insurance, you likely could have just gotten their wellness exam and the things that the insurance would have covered. But for emergencies where, coming up with a certain amount of money and having to make those important decisions is going to be difficult. Yes, I actually do think it's worth it. There's lots of different companies, but I would definitely go for plans that cover emergency care, because that's where it gets expensive. And of course, with insurance, like with any insurance, you never want to have to use it.
Mm-hmm.
But if your pet does develop a chronic illness that requires regular medication, regular care, insurance could be quite literally a lifesaver in that case, because there are conditions that get really costly, but they are manageable. And, owners that I've worked with that have insurance, it's just a lot, less stressful on their budgets to have the insurance in place. But of course, once an illness is diagnosed, it's pre-existing, the insurance won't cover it. So that's where you have to get the insurance in advance. And I hope you would never have to use it, but in those cases, I do find it worth it.
Cool. Okay. Thanks for the question. Scrolling just to catch up on. It's good to see everyone tonight. Hey, crafty lady. Hi, Susan. Life as a mindset, Lorraine. My dog has a skin disorder that's causing his skin to have hard, dry spots that scales. He's a Chinese crested powder puff.
Yeah. I mean, that's as far as like a specific thing like that, I would always just have to say, it should be looked at. The scales could be little areas of infection. I mean, it could be lots of things. So, it, of course, could just be dry skin, but without actually seeing it, it's hard to give you any kind of advice on that. I certainly would recommend having it looked at.
Good. All right. Next question here is from Hannah Webb.
Oh, Hannah was very good in my last video. I wanted to thank her for all the good advice she had in the chat.
Oh, nice. My sister's German short hair pointer has had a bad reaction from a lepto vaccine. I don't want to take any chances, so I have my vet leave the lepto part of the parvo rabies complex of vaccine. I don't know what any of that means.
Yeah. Leptospirosis it's a bacterial infection that dogs get from, usually it's drinking standing water that has runoff of other dogs' urine in it. So a dog with lepto, it passes out in their urine. Another dog might drink from a puddle that has that in it. It can pass to people. So that's where it's getting a bit of attention around here. There's been a little bit of an uptick in lepto, but it is definitely a vaccine that can cause side effects. So that's very much a lifestyle vaccine for me. Not every dog gets it, but the dogs that go out hiking and in the woods, and that certainly lepto. And then I do try to warn about the potential reactions that can happen, not to scare people or deter them from giving it, but just so they're prepared. And then we always make big alerts on the record. If a dog does have a reaction, the first thing you see in the record is this alert that says prior reaction, just so it's not for whatever reason given, or if something happens. But yeah, certainly reactions to that one, and definitely a lifestyle-based vaccine.
Nicey. Some comments here. Let's see. Michael Brosman, good to see you back, Michael. You guys are a hit, in case you didn't know that. Very cute together. Bubba is napping. Okay, that's your vote. We got you. LNG, please give Bubba a carrot. It's such a hoot to watch him chomp on it like a bone steak, like a T-bone steak. We're actually out of carrots. That's how much he likes them. But what he has been eating is Warren Green sent us these chicken and sausage chews or something, and he got addicted too fast. In fact, he's going to get up in a second and bury his head into me to get him another one of those things. So, but he right now cigars. He is. I think he's. Yeah, he's still now. He's actually laid out in a different position. So there is that. Oh, let's see. David Bent, you guys are so good. Meredith giving her time. It's cold in southern Australia. Is it really? Well, yeah, it is winter time there. So. Okay, let's see. I did marry up, Michael. Good point. Crafty lady, good to see you back. Question. My dogs are afraid of the bug zapper. They cling to me whenever they hear the zap. It's not anywhere near them. Up high on a shelf because it's close to the door. Suggestions. I know. That's a tough one. I mean, it's going to be hard to decondition them, I think. It's something about the noise. If there's a way to make it where it's less loud, it doesn't sound like it, or could you move it outside in some way, just move it away from them? But because a bug zapper is something you can't predict, it's going to be hard to get that fear out of them. If it's something you can predict, then what you would want to do is give like a treat, or maybe have another noise that drowns out that noise, or just try to distract them away from it. But sorry, with the bug zapper,
unless you see the bug and know that it's going to happen.
Yeah, stick with fly paper, Crafty.
Yeah, I mean,
find something quietly.
Right.
Like a box or something with bait or something like
and
that.
Dogs, I wonder too, I mean, dogs do feel kind of that electromagnetism in their fur when there's a thunderstorm. I almost wonder if maybe they're sensing some of what's zapping the bug. I'm not saying that, they're getting a zap, but if they're getting some type of electromagnetism from that, I mean, maybe in that case, like a thunder shirt or having a shirt or something covering their fur, but that's all I can think of.
Okay. Thanks for the question, Crafty. All right. Kim Lovejoy, my dachshund, I can't stand that spelling, has been having trouble with his neck for 3 weeks off and on. He will cry out. And then his neck has these spasms. It's his spasms after. His vet said it's his weight. He's 21 pounds. She won't do an x-ray.
Well, and, weight can definitely put stress on the neck and back. Dachshunds, of course, are a breed that's really prone to back issues because of that long spine that they have and their short little legs. I will say this, an x-ray of the neck can be very difficult just because what we're looking for with an x-ray, what dachshunds can get, let me go back, is a bulging discs or intervertebral disc disease. And you actually don't see the discs on an x-ray. You might see maybe that the space between the vertebrae is a little narrower, but x-rays of the neck can be sort of unrewarding. It can, I mean, if you do see a problem, it helps to pinpoint it, but she might also just be worried about him injuring himself in the act of getting an x-ray taken. If he, thrashes or just gets anxious. But yeah, it's definitely, the weight can play a part. Usually it's rest and anti-inflammatories in milder cases where it's just kind of uncomfortable. If it's really painful, worse than that, then of course, got to get a little more aggressive. So, I would hope that he's on some type of pain relief, but, if it's not helping, then I, reach back out to them or seek another opinion if you feel like they're not, properly approaching it.
Thanks for the question. All right. Next is from Teresa Levine. When I warm mini horses and my dog eats their poop, will it do anything to the dogs?
Well, it depends on they can ingest, I guess, some of the dewormer. So it kind of depends on what the dewormer is. If it's an ivermectin dewormer, maybe there could be issues, depending on the breed of your dog. If it's a Sheltie or a Collie or that type of breed, they can have issues or sensitivity to ivermectin. I would certainly try to deter eating any type of poop from themselves, another species, anything like that.
It's a good rule of thumb.
Yeah. Right? I mean, it's just for grossness reasons more than anything. I wouldn't worry as much about them getting the worms, because with a dewormer in the horse, the worms should in theory not be viable or, be dead. But there can be relay ingestion of the medication. So, if you see it happening, probably don't have to, get too worried about it. Rush them right into a vet or anything like that. But I certainly would deter it as best you can.
Gotcha. Okay, let's. Oh, Crafty, she did have fly paper, but it's too ugly. It is.
Yeah.
It's pretty hideous. Okay, Roberta Kelly asked, my last dog had cancer and it was clear to me when to euthanize her. My current dog has gone blind and is on thyroid medication. She only walks for 15 to 20 minutes and is exhausted or sleeps.
Yeah.
So how do you know when the dog needs to be euthanized?
Right. It's hard to give kind of a blanket statement on that. As far as your particular dog, Roberta, for me, it's just looking at the big picture quality of life wise. So I always use this term, and you'll hear it probably from your own vet, of quality of life. And that's different for each dog, just because, of course, dogs enjoy different things. So, if a dog that is a voracious eater downs all of his food immediately, suddenly stops eating, then you can say, all right, this is probably an issue, versus a dog that's always been a little more picky with their food or a little more reticent. Of course, being off their food is not going to raise as many alarm bells. Behavior changes where they used to be interactive but are withdrawn, or opposite, were kind of a quiet dog and then are maybe more seeking attention or restless or kind of wanting to be around you all the time. So just a change in behavior. non-manageable medical conditions, of course, where, the vet has tried everything they can to help with pain or, stop weight loss or whatever it might be. And there's nothing to get under control to the point where they're in regular, consistent pain. Obviously, that's a big quality of life indicator. So in your dog's case, walks for 15 to 20 minutes and is exhausted, if she was always kind of a mellow dog to begin with, and that's less concerning to me. Just like with us, activity level tends to go down with age.
Speak for yourself.
So yeah, the things that you're saying aren't necessarily indicators to me that tell me that it's time, but if there's just pain indicators where there's vocalizing or restlessness or can't get settled, change in appetite, change in behaviors, unmanageable medical conditions, that's where the decision tends to be more clear. This doesn't happen in every case, but I do feel like there's sometimes you can just kind of look in the dog's eyes or just try to kind of, I don't want to sound hokey, but just you kind of know with your own dog,
right?
The way they look at you, the way they just
don't respond or respond.
Yeah. I mean, we could kind of tell with ours when we've had to make that decision.
This one's going to be a tough one.
Bob, it'll be tough. Yeah, it will. I don't want to think about it, but yeah, just sometimes that spark's not in the eye anymore. And I know that's unquantifiable, but often it just is a personal thing where you just they've told you in different ways.
Okay. Thanks for the question, Roberta. Hope things work out well. Mary Hubble is here. Good to see you, Corey Meredith. Good to see you, Mary. Question from Meredith. Do you know anything about the 4,000 beagles bred for labs? Will they be up for adoption soon? Has a DOJ sent out any info to veterinarians?
I haven't gotten anything just through my office. Actually have a friend that works at one of these shelters that's going to be taking a fair number of those beagles. So I've seen her post about it. Sad situation, but I'm glad they're getting help. So I haven't gotten anything specific. They are not available yet. I don't know any dates on that. Sorry, Mary, but they will be at the different shelters here around Boston, Northeast Animal Shelter and MSPCA Angel. I know we're the big coordinators trying to help with that. So maybe looking at their web pages, they might have more information. It's Northeast Animal Shelter, which is in Salem, Mass, or Peabody. Salem.
That's a big
and
one.
Then MSPCA Angel is in Boston. So they might have more information on that.
Cool. Okay. Thanks for the question. All right. Next one. This comes from Kathleen D, who says, I have a cat who loves to sleep in the bed with me, but he will bite if I move in my sleep. He's very sweet, but just walks up and bites. Anything I can do? That's
a tough one. I mean, cats can definitely, how should I put it? They don't want to be disturbed when they're sleeping or,
yeah, you must be flailing in your sleep.
Other than keeping him off of the bed or not allowing him in the room, I think that's something that is going to be hard to train out of them. Making your displeasure known when it happens, maybe removing them from the bed at that point, certainly not doing anything to reward it, like petting or giving positive attention, but removing them from the room if it happens, or just honestly avoiding it entirely by not letting them on the bed anymore. But I can't really think of anything, there's no specific medication or anything like that that's going to stop it. It's just letting them know that you're not happy with it, and hopefully they turn it around.
Yeah, the behavior questions are tough.
They are, because there's no one.
Amanda Engel suggests a spray bottle.
Well, I know, Amanda, I do. There are times where I say spray bottle. With biting, I'm always a little cautious just because I don't want it to stimulate more biting. Because if it's a really noxious correction, like some cats would really hate getting sprayed, it might just stimulate them to bite you again. So just have to be a little, with biting, I'm always just a little more cautious about recommending negative reinforcement. But yeah, spray bottles can be helpful for deterring behaviors. Just with a little word of caution that biting is, I always kind of treat that a little more, especially just because of the potential danger and, pain it can cause to the person. But yeah, a spray bottle, a loud noise, actually, that makes me think of, gosh, if you have something near your bed, like shaking keys, or I was told people like put coins in a jar. And if your cat or dog does something that you don't want them to do, shake the jar and make that loud noise. That sometimes can kind of shift them out of a behavior. Hopefully wouldn't make them want to bite you more.
Okay. Well, thanks for the question, Kathleen D. Damon's with us tonight. How you doing, Damon? He also noticed my haircut. And that makes Damon our viewer of the night so far.
Yep.
And Damon's question is, why do cats or dogs automatically warm up to certain people?
Well, and just one, Kathleen said the cat comes up on the bed while you're sleeping.
Yeah.
And that's where just closing the bedroom door where they can't come in the bedroom. I totally get it that you can't stop them from coming up on the bed in other ways, but other than just keeping them out of that room, and maybe try eventually if it seems like you want to give it a try again. But that's really the only way. If they jump up on the bed while you're sleeping, just keeping them out of the room entirely.
Do they still make the clap on, clap off for the lights?
Lights, probably.
There you go.
Well, you said Damon had a question. Why do dogs or cats automatically warm up to certain people? I don't know. I do think that some people give off a certain aura or certain comfort with animals that the animal might respond to or feel. And conversely, there's obviously people that are very afraid of animals that a dog or cat can sense that too. So I think there's just that whatever cues you're giving to the animal. With dogs, I learned in 22 years of being a vet now that, when I would walk into an exam room, I would just really try to get down to their level very quickly. And, dogs tend to appreciate that when you're not looming over them. I think that's also why I like giant breeds, because then I don't have to bend all the way down. But yeah, the dogs and cats, they can read it. They know when you're comfortable and not afraid. And I think that's probably why.
It's weird. We had one dog that I don't think cared at all about us.
Which dog was that?
Moose.
Oh, Moose.
We had one dog that loved other dogs and kids, like little kids.
Yeah.
Loved them. But around adults, he couldn't be bothered.
I know. He had a little screw loose.
Yeah. But it was weird, but because he did nothing
right.
around us. And then when we had friends and their young family come and play, he was a totally different animal.
Well, and this, because Wilk had a question I remember here. So I'm going to steal your questions from you.
Wilk is right here, Mar.
Hi, Wilk. Oh, yeah. So
Wilk, here we go.
I remember your question, Wilk, about your wife brought home a cat and she loves you and hates her. So meaning the cat loves you and hates her. I feel bad for your wife. I empathize because most of my dogs have preferred him to me just because he's the fun guy who's home all day, gives them the treats, plays outside with them constantly. Whereas I'm the one that trims their nails and gives them shots and takes blood from them when they need their blood tests and things like that. So yeah, I feel your wife's pain in this regard. I don't have a good answer for you because your wife was the one that brought the cat home. So in theory, your wife should be the one that the cat's attached to, but
cats are weird.
Cats can be different. Usually, if the animals tend to like the person that's feeding them. So if you're the one feeding, if that's the case, then maybe have your wife do the feeding, give treats, that kind of thing. But yeah, I'm not sure why that happened. If your cat, if they were adopted as an adult or maybe had some prior experience with women that wasn't great. Sometimes it is gender specific where, we've had dogs that in most cases they're scared of males. They had a bad prior experience with male and then they, are scared of other men in the future. But maybe it's the opposite for your cat. Had a not so nice female in its prior life and is transferring that to your wife. but she can butter them up.
What you looking
I think.
for?
Well, Wilk's responding.
Oh, what does Wilk say?
No, she does. She feeds them. Oh.
No, Mary wants me to trim Bubba's nails. That's also a no.
He helps me. You have to hold him sometimes when he's being more nudgy.
He's a wicked baby.
Yeah.
So, okay. Thanks for the question. Moving on, we have this from Lori Putz. Let's see. She has 2 11-year-old fixed female declawed rescued cats. We didn't declaw, and they were rescued at different times. Had the second one over a year, and they do not like each other. They tolerate each other because both love my husband. The second cat, a dementia surrender, does not play at all. How can you teach a cat to play and guard the halls from each other?
Okay. And I'm going to keep this because that's a long question. So I want to refer back to it if I need. So it sounds like the second one was adopted after you had the first one for quite a while. The second one, if it was a dementia surrender, I wonder if it was the only cat in that household. And not to, project on this, but I would think that the prior owner was maybe elderly or older and not quite as active. So that's why the cat maybe didn't play very much with that person. So it probably just doesn't really have that instinct of wanting to play. You could certainly just still try different types of toys. Some cats like to chase a laser pointer. Others like the toys that look like fishing poles where they're running around chasing things hanging off a pole. There's games where you can push a ball in a circle, that kind of thing. But if you've tried those different types of play activities and they haven't taken any of them, it may just be a cat that is more sedentary, like our dog. I can't get him to play to save my life. No. And then as far as guarding the halls, so if it's just in the hallway where they're passing each other and you otherwise keep them separate, the one thing I would suggest, there's a product called Feel Away, which is a cat pheromone, and it comes in a spray where you can spray it in the house. It also does come in a plug-in, kind of like an aroma plug-in that you would use for scent in your house. So you could plug a Feel Away in the hallway. That can sometimes just help. I know, not everyone believes in aromatherapy or that kind of thing, but it can sometimes help with calming and with anxiety or aggressive behaviors. And you can find that at any pet store or online ordering. I like Feel Away. It doesn't work for every pet, but I think it can be at least helpful.
You say that, and I think of the Eddie Rabbit song "Steal Away." Remember that one?
I do.
I don't
know if it's. I say Feel Away. It might be Fell Away. I don't know.
Either way. Let's see. Damon says, Dr. Meredith, you're doing a good job, by the way. I can tell you're more comfortable in front of the camera.
Yeah, I was nervous the first time just because I wasn't sure how many people would be watching. Don't want to say wrong things either, but I feel better.
Yeah. All right. Our next question comes from Shay Kitty. Our 12-year-old
Miniature pinscher.
Oh, okay. Miniature pinscher is having diarrhea and some vomiting, but still eating and acting normal. Should we be concerned?
Well, that's a tough one. Without knowing your dog in particular, or having seen them, the one thing that does make my ears go up a little bit is 12 years old. On the older side, toy breed or small breeds, so they do tend to live a little bit longer, but certainly in a senior category. So, the big picture wise, when we're talking about GI symptoms like vomiting and diarrhea, if it's a dog that tends to get those things, sensitive stomach type of dog, and it's just one episode of vomiting, one episode of diarrhea, then certainly probably, I shouldn't say certainly, but probably no need to rush into the vet, especially if they are eating and acting normal otherwise. Several episodes of vomiting in a dog that doesn't usually have that issue, that they should get in sooner than later because of the possibility for dehydration. And there's just way too many possibilities or potential diagnoses for what can cause vomiting to get into. But yeah, if there's other symptoms in addition to the vomiting and diarrhea, like lethargy, doesn't want to eat or drink. Maybe when you go to touch the belly, they act a little painful or, act uncomfortable, like it hurts. then those are potential, emergent, get in sooner than later kind of things. 1 or 2 episodes where they're eating and acting normal, otherwise less of a emergency, but still has to be watched closely. And then definitely, there was one other thing I was going to say. If you know that they got into something, you're not toxic. Obviously, toxicity is a whole other category. But if you know that they maybe, ate something out of the trash, or, ate a little bit of grass in the yard, that kind of thing, you could probably trace the GI signs back to something like that. And if they go away on their own pretty quickly and they're otherwise acting normal, doesn't always warrant a visit. But talking to your local vet in cases like that obviously can be important as well, because if they've seen your dog for that type of symptom before, they might be able to guide you on the phone. If it's a kind of a repetitive issue. But yeah, just there's too many possible explanations for that to say for sure. The fact that they were still eating and acting normal makes me feel better. But and this was from several weeks ago now, so I hope they're okay. But if it's still going on, definitely, and it's a new type of thing for your dog, definitely get them in.
Cool. All right, thanks for the question. This one is from Dorothy Lynn, longtime viewer. My cat was put on an antidepressant a couple of years ago because he kept attacking my other cat. Will he eventually be able to get off of it?
Oh, wow. Yeah. And I mean, if there was a reason why the attacks were happening, like you could pinpoint something that was maybe causing some stress between them, then yeah, by all means, we often do try to wean off of those types of medications if we know the inciting cause was eliminated. And even if not, if there wasn't really an inciting cause and it just started, then potentially. But with most of them, you do want to wean them, not stop them cold turkey. So yeah, I would, talk to your vet, and if it's been a couple of years and they haven't had any bad interactions, maybe a slow taper over a few months' time. Anytime we're tapering a med, I always just say, if the symptom comes back, or if the problem comes back when we're at a certain point in the taper, that tells you, no, we can't stop, or maybe we can lower the dose, but not stop entirely. So yeah, I would definitely discuss it with your vet, because you don't want to have to give us a medication lifelong if you don't need to.
Right. Hi, Lizelle. Good to see you tonight. Hi, Catherine Shen. Good to see you. Catherine says, thanks for answering my question last time. I love that you're doing the show. Thank you. Well, you're welcome. Susan Cox asks, is Bubba hard to bathe?
Oh my God. Yes. So we got Bubba. He was already 4 years old when we adopted him. So he had built-in hatred of certain things that, and baths were one of them. So I did manage to get him into the tub twice. I've managed, but both times it was with great, effort. And it just,
yeah, he hates it.
Yeah. A couple times we've bathed them outside too, where we just wet towels and use that to bathe them. That's worked. And he actually doesn't mind. We have a pool, and he doesn't mind on a hot day getting splashed on his head just to cool him down.
A little bit. He gets weird about that too.
Yeah.
You can do it a couple
but
times.
Yeah, he hates baths, and I kind of gave up trying to fix that, because he wins when we, whenever I try to force him to do something, he wins. He's just too big for me to handle. So we find other ways to keep the smell down, but
yeah, well, we can't walk. We're about a half mile from the beach, but he won't walk that far. He hates the car, so we can't put him in a car to drive him somewhere to see if he likes the water. Yeah. So that's it. He's landlocked.
He's tough.
Yeah, but thanks for the question. Let's see. Damon, Dr. Meredith, have you always wanted to be a vet? How long was vet school?
Oh gosh, I don't want to go on about myself for too long.
Oh yeah, no, just a couple hours tonight.
So I kind of figured it out, I think my freshman year in college. So here in the US, it might be different elsewhere. But you finish up high school, you go to undergrad. Usually it's 4 years of undergrad. Some vet schools you can get in after 3 years, but typically it's 4 years. And then vet school itself is 4 years as well. So it's a long process. And I thought initially when I went to undergrad, I thought that I was going to be a doctor, do human medicine. And then I realized I did not want to work in a hospital because I didn't like people. Yeah, no, I'm just kidding. But yeah, there were several reasons why I realized that human medicine didn't interest me, but I could very easily transition that to veterinary medicine. And actually I do remember going with my mom when our dog needed to go to the vet growing up, and that I just had I really liked the particular person that we saw, and just kind of realized that maybe that's something I could do. So yeah, probably freshman year of undergrad, in between freshman and sophomore years, when I decided on it. And then did the 4 years of vet school. I did a 1-year internship after vet school as well, which is not required. Internships and residencies are required in human medicine, not required in veterinary medicine. But if you want to specialize in certain fields, then you have to do an internship. And then usually it's a 3-year residency after the internship. So I did the internship because I wasn't sure, but then I decided just to go into general practice. So I did not do a residency after that, but that was it.
Cool. Some nice comments out there. howspiritworks.com. Hello, Meredith and Corey. I love this show. Thanks for being here. Well, thank you. Teresa, you actually had a Mastiff. Yeah, we like our Mastiff. They're fun. Okay, Susan Johnson, yes. Were you a biology major?
I was, yeah, biological sciences it was, but yeah, biology. And everything, really the tracks or what you study to go to med school is really the same as what you would study to go to vet school. So, you have to take a lot of science courses. If you have any young, kids or young people, it's a lot of science, but it's worth it.
That's your thing. Yeah. Not my thing though.
Yeah.
Thanks for the question. Okay. Next, this is from Vicky K. What breed or breeds of dogs are known to have the longest lives?
The smaller the dog, the longer the life expectancy. And so your typical, it would be like, say, your Maltese, your toy poodles, Yorkies. Yeah. And that's in a general sense. That those would be the breeds that tend to live longest, your 15 pounds and under. And then on the converse side, your giant breeds, have the shorter life expectancies. Mastiffs being one. Bubba is definitely a geriatric, but he's not showing it at all. So yeah, your teacups can live into their later teens on a routine basis.
Yeah, Bricky has those.
Yeah. Versus your giant breeds who 8 to 10 tends to be their life expectancy.
There you have it. Okay, thanks for the question, Vicky. Just checking through. Okay. Our next question comes from, how about this one from Barbara Everly? I have a Sharp Eagle.
Sharp Beagle, maybe?
Sharp Beagle. Well, Sharp Eagle is how it was copied and pasted.
I wonder if that's a typo, but it could be a combination of a Sharp with a Beagle.
14 months old. She's gone to boot camp. They couldn't get her potty trained. She spends her day in the backyard and gets walks. She won't do her business outside.
Oh, no fun.
Any suggestions?
Well, and then 2 below that, we also have Joy V, who says, I'm trying to house train a 12-week-old Havanese, and any suggestions? So a little bit of a different situation where you have now an adult dog who's not responding to potty training, but we can kind of talk about it in a broad way. So yeah, with your 14-month-old dog that just, it hasn't worked. Gosh, and she even went to boot camp too. So the one thing that you said, she spends her day in the backyard. So I wonder if she's always outside, then does she not see, that's a tough one. Does she not see the outside as a place to do her business? Like doesn't want to spoil her where she's spending a lot of her day? I might be coming to the wrong conclusion from the way you asked your question, but yeah, it's if she just absolutely won't go outside, that's odd.
Yeah, maybe it's got one. Yeah, who knows?
Usually a dog doesn't want to do their business near where they have to sleep. And so that's where crate training.
That's where that term comes from.
What?
Don't shit where you sleep.
Yeah, probably. So that's where the theory of crate training comes in, where if they are kept in a fairly small area, a big enough crate where they can stand up and move around freely, but not go to the other side of it and get away from their urine, that usually teaches a dog to hold it. And then, of course, you want to be taking them out of that on a regular basis and go to the place where you want them to go. So I wonder if crate training, you don't mention having tried that, but if that would help. And then as far as training the 12-week-old puppy, same thing, really trying to keep them in a fairly confined area and then get them on a schedule where you're taking them out at certain intervals. Dogs usually, they can kind of get a clockwork or remember, all right, it's getting close to 5 hours now, but mom's going to take me out soon. So I'm going to hold it a little bit longer and we're going to go, because I know we're going to go for a walk soon. And when you do go for that walk, try to go to the same spot. Just there, you're attracting them, or you're using the scent of what they've done there before to then tell them, okay, this is where I go. So yeah, I am a big proponent of crate training done right. Just because, again, they're not going to want to have an accident and then have to sleep near it. With the done right means that they do have to be taken out very regularly. And that's where you try to keep a consistency to it, go to the same spot, really try to keep the same intervals on a daily basis. And it takes time. I find that house training in general takes usually a good few months. He's up of that consistency, and they're going to have setbacks, but just stay with it. Dogs want structure. They want training for the most part. So just stay with it and you'll get there. The 14-month-old, that's definitely a tougher situation, but you don't mention having tried crate training before. So that would be my one suggestion. And then if she hasn't been medically evaluated, just on the off chance that there's an actual issue in her urinary tract, I would think about having a urinalysis done, or maybe some imaging or ultrasound of her bladder, just to see if there's something medically that's making it hard for her to hold it. Just talk about that with your vet.
There you have it. Good question. Moving on, there's another one from Mari. How can I tell if my big dog has a UTI, boy or girl? Mm-hmm. Signs or symptoms?
Mm-hmm. Well, UTIs in general are much more common in females than males, kind of like in people. The anatomy of the urinary tract plays a part in that. So yeah, much more common in females. Males, it's pretty unusual, but it can happen by all means. So frequent urination with a sudden urge, like gotta go now kind of thing. Certainly blood in the urine, or going small amounts more frequently versus a large amount. Those are the main symptoms to look for. We'll see a lot of UTIs at the start of winter when we have our first snowstorm, because when a dog goes to urinates on grass, you can't tell if it's discolored or if there's blood in it. But then that first snow, and the person looks, and actually where the dog urinated, it's pink instead. But yeah, the discoloration of the urine is a big thing.
All right. Thanks for the question, Mari.
And they can also start to act sick too, if it's really, affecting them. So maybe just a change in energy level, change in demeanor.
Here's a weird one from Giselle. Is it common for a dog to spin in circles before pooping? Times. My palm spins a lot. One time I counted 29 times before she pooped. That's one dizzy poop.
Yeah. I think it is very common. I think 29 times is a lot, but yeah, a lot of dogs do that spin. I don't know why. They'll usually, do the kick afterwards to cover it up too.
I've seen the kick. I've never seen the spin.
Yeah, no, Bubba does.
Spin?
Yeah.
To do that?
Yeah, they're walking, they find their spot, but then they, might have to do a little
double back, I guess.
Yeah. They want to point the right direction, I guess.
No, but I see he spins like a lot of dogs spin before they go to sleep.
Yeah, definitely.
But I've heard that it's because Even like prehistorically, dogs would do that to like mat down forest beds or something where they were going to lie.
Mhm.
So it's just to mat down their bedding.
Yeah, I don't know why they would do it for pooping, but yeah, I definitely 29 times though. That makes me wonder if maybe they were a little constipated and just had to
get
do
some extra motion in there.
Do some disco to get it out.
But it's like Moose did that.
Yeah.
Or what kind of dog was he?
Moose was a pointer mix.
Oh yeah.
Like a German short hair pointer mix.
He would, I'd feel bad for him. He was spinning around so much before he chilled out. But anyway, let's see. Hannah, are urinary crystals a likely sign of bladder cancer?
Oh, no, I wouldn't put those two things together, Hannah. They both can cause similar symptoms. So definitely, having crystals and then having a tumor in the bladder might cause an urge and a frequency and a discoloration to the urine. But just because a dog or cat has crystals, I wouldn't connect that to them having cancer. Crystals are actually a pretty common issue in cats. And bladder cancer in general is pretty uncommon. I mean, it certainly does happen, but it's much less common than crystals. Scotties are a breed, Scottish terriers that are known to, they're a little higher on the list for getting bladder tumors, but pretty uncommon in general.
Following up, Amanda Engels, don't they always poop on the north-south axis?
I don't think so. No. I don't think Bubba knows which way is north or south.
There he is.
He's up. You getting hungry?
I won't be there for long.
Yeah.
What you need, Bubs?
You feeling left out?
What a good boy.
You feel left out.
All right.
Surprised he's not in the closet.
What you need? Yeah, I know.
Yeah, he wants his. I notice he goes to Corey for that.
All right, I'll get him in a second. Here's your question. In the meantime, Meredith.
I love you.
This is from DZZ, who says, my dog threw his back out. Are there things I can do at home to help him heal? Something like human physical therapy.
So we were talking about earlier with a dachshund and a neck injury. Back, the same thing can happen with their back. So if it's a bulging disc issue, that we have to be really careful, because any type of like massage or pressure can actually make that worse. If it's a muscle issue, like they pulled a muscle, or just more of a soft tissue injury and not a bulging disc, then certainly massage and sometimes heat or cooling on it can be helpful. Making that distinction can be a little tough because, like I was saying earlier, it's hard to see a bulging disc on an X-ray or know that it's a disc versus a muscle. Usually with a disc, when you press down on that intervertebral space, you'll get a pain reaction, versus muscle might be more lateralized or not right over the points of the vertebrae. And then breed wise, certainly there's breeds that are much more prone to disc issues, like the dachshund or the corgi or those long back dogs. But I hesitate to give any specific advice on that, just because it's a lot different for a muscular injury or musculoskeletal problem versus a bulging disc. So just be cautious with anything you want to do at home. Usually heat or ice is not going to cause a problem, but any massage or pressure is where, I wouldn't push you in that direction without having it actually examined or know, what's going on.
Good. Thanks for the question, DZZ. Let's see. How about this one from howspiritworks.com? I've noticed at my vet, they are addressing pain more effectively after surgery. Is this a new insight? Yeah,
I definitely, speaking for myself, I'm much more focused on pain relief now than I was when I first started my career in 2000. And there's a lot of things that have evolved, I think, within the last, say, 5 to 10 years. So pain relief in a preemptive way. So see, it looks like a cigar. Give it to him. He's so mean.
What a good boy.
So addressing pain preemptively before it even happens or starts is very important. and then continuing to address it post-operatively for as long as necessary, depending on the intensity of the procedure. It is definitely a more recent phenomenon, but it's a good thing. The old school way was, oh, animals don't feel pain, but they most certainly do. And we knew that they did. We just didn't have a lot of the current medications that we use weren't even available, or just didn't really know how important it was to address it. And the same we were talking in the last show about fear-free practice. The trying to decrease the anxiety that a pet can feel at the vet. That's also a new thing and a very, very good thing.
Cool. Let's catch up with some folks here. People said hi to Bubba. Of course, he is a small horse. So there is that. Bubba is a giant baby.
Mm-hmm.
Let's see. Vicky Nedwick wants to know, hi, Marby. How you doing, by the way? Vicky, why does my dog always try to lick off my lotion?
It probably the scent, and it might have a good taste to them too. I mean, dogs eat all sorts of weird things, but yeah, Bubba does that. He likes it.
There you go, Vicky. Michael asked.
Well, and wait.
Go ahead.
And it's not usually not something that would be dangerous for them, but in large amounts, if they're actually ingesting large amounts of lotion, but if they're just licking it off your skin, probably less of a concern.
Yeah, don't have them finish off the Noxzema bottle.
Yeah, right.
Michael has a question for the doctor. Do pet owners live longer from loving their pets and the love they give?
I think so. It's for multiple reasons. I think that it's less stress on their systems when they have a loving home, which anxiety and stress can certainly affect lots of different physical, ailments. And then maybe those people are more likely to seek care. I don't want to say this in a way that seems negative towards certain pet owners, but the ones that notice because they're very involved in their dog's life, so they might notice changes sooner than someone who doesn't interact with their dog as much. I definitely think that a loving home is. I know he's slobbering.
I have another treat on the desk, and he can smell it. So he's going crazy.
He's got a good sniffer.
Yeah, he's got a giant nose. All right, Bubs, one more.
He shouldn't like you more the way you tease him.
What a good boy.
Oh, he made noise. Wow, that was a vacuum sound.
Thanks, Warren Green, for the treats.
Yes, he loves them, obviously.
Bub likes them. Oh, Meredith took them right out of the
Well, I thought I can't see the chat.
Well, how long does he sit up like this? This is a very rare moment, folks.
Why? That he's up?
He's been sitting up for 15 straight seconds. Let's see how long that lasts.
My God, he's better at looking at the camera than I am.
That already made him tired.
He's yawning.
2 treats in a row. All right, how about this one from Crafty Lady? Would lemongrass, if used in aromatherapy, harm dogs? Lemongrass.
I might need to pass on that one. I'm not sure. I'm not familiar with lemongrass, so sorry I can't answer that one, but I don't want to give a invalid answer. There are definitely, I've heard of diffusers or oils that actually can be problematic for dogs. So I'm sorry, I don't want to speak wrong on that.
That's fine.
If anyone out in the chat has any experience with that, maybe feel free to give your opinion, but I'm not sure.
Such a bad boy. That's funny stuff. All right. Next question comes from Linda Casey, who says, hi, Dr. Meredith.
Hi.
I have 2 elderly dogs with poor dental hygiene. My vet is hesitant to put them under narcosis because of other medical issues. One has loose teeth and a heart murmur. I feed them soft food and very small kibbles. Other than surgery, is there any other solution to keep them as comfortable as possible and pain-free?
Okay, I'm going to take the sheet for that one too. So tough one, Linda, because definitely heart disease. So I'm presuming with the heart murmur that there's some underlying cause of it. Definitely can increase anesthetic risk. So the kind of aggressive approach aggressive, I mean, in a good way, like trying to exhaust all options, would be to have the heart murmur investigated further. So consulting with a cardiologist, having an echocardiogram done, they could say if the heart murmur is more of an innocent one where, yes, it's present, maybe there is some mild disease, but nothing extensive that requires medicating, and it's less of an anesthetic risk. And that might, make you feel a little more comfortable about putting them under anesthesia. I try to have that done before we anesthetize a patient with a heart murmur. But of course, there's many cases where it's either not financially feasible, or if we have an emergency situation or something that needs to be done more quickly. Right now, getting our cardiologist in, it's taking, I think, 2 to 3 months. So if we have to be a little more expedient, then we will anesthetize patients with heart murmurs and just try to be very careful about what we're using for the anesthesia. And then of course, just very, very close monitoring. So you can, perform anesthesia on a patient with a heart murmur. I will be honest and say it's nerve-wracking in some cases, but I did one, a couple weeks ago, similar patient, elderly with a heart murmur. It had an echocardiogram, so that made me feel a little more comfortable. But even without that, I probably still would have done the procedure just because the mouth was so bad for this dog. And it can definitely be really painful. And actually, oral disease can cause a lot of other health problems too. So, the bacteria and inflammation from in the mouth can affect the rest of the body. So just having a heart murmur it doesn't mean that they can't be anesthetized. I guess that was the point of that long spiel. If in your dog's particular case, it's really extensive heart disease, or, your vet does not feel comfortable with that, then I totally understand. I'm not saying that they're making the wrong call, but softening the food like you're doing, giving very small kibble, definitely that is going to be less painful for them to chew on. It's probably past the point where any type of toothbrushing would be helpful, to be honest with you. And that might just be more painful than helpful. So I wouldn't suggest brushing. If your vet feels like that can work in your dog's case, by all means, but I'm not going to say that without having looked at the mouth. And then, you can actually use pain relievers, oral pain relief, sometimes antibiotics too. I've had cases where we couldn't do the procedure and there was obviously infection in the mouth, and a course of antibiotics would quiet it down, not resolve the underlying problem, but at least improve the animal's quality of life and quiet the issue down temporarily. So antibiotics potentially, those would be probably your main options. And there was another question. It was at the top of the page. Amanda Engels had asked, is toothpaste rubbed in the mouth just as effective as brushing teeth?
Mm-hmm.
So we'll address that too, since we're dealing with dental stuff. Amanda, to me, it's whatever you can do. Certainly toothpaste just on a finger, rubbing on the teeth, it's not going to be as effective as using an actual bristled brush, or like one of those finger brushes that you can put onto your finger. But if the toothpaste is on your finger and you're using that to brush, you do want to just have a little bit of friction between the toothpaste and the tooth. So like letting your dog lick toothpaste, I don't think that's going to help. But if you're putting it on your finger and actually doing some, friction or motion on the teeth, yes. But a bristled toothbrush, whether it's using an actual brush or the ones that slip onto your finger and then have, the bristles on it, would be better. But to me, it's, good, better, best. The toothpaste on your finger on its own is helpful. I've actually also heard of wipes that the wipe itself has like an antibacterial or something in it that would help, with oral disease. So using that wipe instead of toothpaste, if your dog lets you do that, that's also a way to get a little friction there without using an actual brush.
Cool.
And we had talked in the last show about vohc.org is Veterinary Oral Health Council. They on their website have a list of products that they have tested or decided are effective and safe for dogs and cats. So check that out for. I think the wipes are on there. Yeah. I haven't looked at it recently, but I think they are on there.
All right, we're past the 1 hour mark here. So welcome to the new people who've hopped in after the 8 o'clock Eastern time hour. I'm Corey from Bridge Cape Ann. She is the Good Doctor Meredith here, a real live veterinarian taking your pet care questions. We have this question now from a viewer named Heather Atwood.
Hi, Heather.
Hi, you guys. Why does Ruby need to have something in her mouth every time she has a transition? When we get close to home in the car, she needs to get a mask or a hairbrush from my bag.
Oh, that's funny. So Heather is Corey's co-host on his other show.
My other TV wife.
Yeah. Yep. Exactly. And she has a very cute little dog named Ruby. So I think it's just a soothing thing for her. It's kind of like that child that would carry around their
security blanket
or want to have the pacifier in. I think it's just kind of a fun thing for her. I wouldn't worry about it. I think she's just grabbing onto something because she's excited and maybe wants to take it with her wherever she's going.
That's all it is.
I think so.
Yeah.
I know Ruby. She's a sweetheart.
Yeah. Thanks for the question, Heather. Get back to work, please. All right. This question is from Liz T. I have a 15-year-old dog who only gets excited when she wants to go out or eat and is no longer affectionate. I had to leave her for weeks due to my heart issues. Can I do anything for her to be more affectionate?
Well, we were talking earlier in the show about, quality of life indicators. And Liz, I'm sorry, I shouldn't have said that. I'm not saying that your dog has a poor quality of life, but a change in behavior like that is certainly something that can, make me worried. So looking at the big picture, it does sound like she's still eating. That's good. And she'll get up and go out. So those are all good things. But the change in behavior where she's less affectionate with you makes me wonder if there is maybe something going on that's making her not feel so great. Other than laying on the charm, lots of TLC coming from you that maybe then she starts to give it back to you again. But, it might be a reason to have her checked out. Just that withdrawing or that behavior change could be a indicator of something.
15 years old.
But it could also just be that she's just a little more tired in general, that older person that doesn't seek attention as much,
Yeah, could be. All right. Thanks for the question, Liz, too. Appreciate it. Thanks, Michael. If you got to take off for a bit, we'll see you soon. Dorothy Lynn has another question. What age should cats start getting their teeth cleaned?
That can vary because there are some cats and dogs that really have, very healthy teeth. They just genetically seem less prone to dental issues than, other breeds or other cats. So broadly, I'd say maybe by 7 to 10 years for cats. But at the same time, I've seen, 2 or 3-year-old cats that have a condition where they get a lot of inflammation in their gums. So they would need it much younger. But if you look, so, if your cat's friendly or your dog, you can just kind of flip their lip up and just look. What you're looking at, of course, is the tooth, that white crown of the tooth that's below the gum. And then where the tooth contacts or, comes in contact with the gum, you want to see if that gum is red at all or irritated compared to the rest of the mouth. So if that particular line right above where the tooth meets the gum is quite red or irritated, then that's a sign it's gingivitis. So that's a sign that maybe they need to have tartar removed and have that addressed. And then on the tooth itself, if you see like a yellow or a brown film or cake on the tooth, oh my God.
This is the last one for the night.
Then that's what we're doing when we clean the teeth. We're scaling that tartar off. And by doing so, we're addressing the secondary gingivitis and disease that's present. I can't believe
he's never fought me over one before. He's good with me.
Bubba, you can bite him. Go ahead.
You weirdo. What a good boy. This was 95th bone today. Eat that's all over my leg now. All right. Thanks for that. Are you good, Mer?
Yes.
Let's see what else is going on in here. Good info projects. Heather, we love you
Thank
too.
you, Heather. We love you too.
Thank you. Crafty says maybe she thought she was abandoned. Who knows?
Heather's Ruby?
That's what I'm guessing. Who knows?
Ruby is not going to be abandoned.
How about this one from Ange Humphreys? My dog cries when he hears the Benny Hill theme song.
Oh gosh.
Does anyone else have this?
Do you remember that song?
That's like that. Yeah, of course. Yeah,
maybe it's just I don't know if there's high pitched stuff in it.
That's like when Mary Hart was causing the epileptic seizures in people who used to watch was it Entertainment Tonight?
Yeah.
What was that?
Was it Mary Hart?
Was it Mary Hart?
I think so. Yeah.
Who knows? Does he do that with car tires, Michael?
So
he would. He's latched on to some pretty big stuff. Lena, don't you worry about it. We're just getting going here. We have another 3-4 hours to go, I think, tonight.
Oh gosh. No.
So, all right. The next question comes from, let's see. How about this? From She Talks to Angels 19. It's a long one, folks, so stay with us. This is like when Casey Kasem used to read the stories before.
Thank you for getting me more drink, honey.
Thanks for doing this. My question is, my dog Frankie puts on a growling show complete with a fur mohawk at some, but not all dogs when we're on our walks. We used to use a squirt gun to calm him down, and he will listen as soon as he sees it. But is there another way to discipline him, especially when we don't have it? Like when we're in Home Depot, for example, it can be very embarrassing because he looks so aggressive when it happens. He loves all people, but not all dogs, unfortunately.
Yeah. So yeah, the squirt gun, we were talking about this a little earlier in the show too, as far as like correcting behaviors that you want them to stop. So yeah, squirt guns can be useful for that as long as it's not something that accelerates or increases the negative behavior. So some dogs react to it in a way that's actually counterproductive. But if their reaction to it is to stop the behavior and they're not, going into an anxious state from it, then yeah, squirt bottles can be very helpful. I was talking earlier about loud noises. So, obviously if you're in Home Depot, you don't necessarily want to make a too loud of a noise, but clap a really aggressive clap or something where you can just really get their attention. If you have keys on you, like your car keys, just jangle those, or, if you're in a store that has shelving, you can knock on the shelving, anything that makes a loud noise that's going to snap them out of it. You just want to break their almost like their train of thought or their focus on what's bothering them. And so it can take a pretty loud stimulus to do that, but you just want to break them of it. And you also actually want it to be something that's maybe a little, not such a pleasant noise too. Again, not saying that you need to set off a boat horn in Home Depot, but just something that's not a pleasant sound, that's going to get their attention and they're not going to enjoy it. So then hopefully they start to associate that with, okay, when I got a little upset at that other dog, mom made that noise and I really didn't like it. So maybe I'm not going to get upset this time. So that it's way oversimplifying. Behavior issues are just so far beyond, just having easy answers. But yeah, that is something you could do. And then actually trying to redirect or refocus their attention before the stimulus even happens. So if you see a dog coming and they haven't noticed yet, then get them into a sit position or just focused on you. And maybe even try to, at that point, sneak a little reward to them, like a treat or even just a head rub, just something that's pleasant. So they're in that, happy headspace. And then maybe the dog walking by that they usually wouldn't enjoy, it's not going to bother them. So yeah, a couple ideas for you. It may also be specific to the breed or the gender of the other dog. I know for the most part, dogs, well, this is a generality, but I find that more than 50% of the time, dogs tend to react to the opposite gender. So a female dog no, I said that wrong. The same gender. So a female dog might be more reactive towards another female, and a male is usually more reactive towards another male than vice versa. And that's just my experience and opinion. I don't have statistics on it. I just, have noticed that. And that Bella, our yellow lab, would get testy with other females, but not males. So, seeing if you ever notice that it is a certain gender on the dogs that your dog is reacting to, not that it changes anything, but that may give you an indication of why it only happens with certain dogs.
Good. Yep. Okay. And our current poll question is Heather Atwood's dog something we should all be concerned about?
Of course not.
Oh, most people are saying no, but some are saying there could be an issue.
Don't make Heather worry. No, Ruby's fine.
Helicopter mom. Everyone is.
That's a good thing.
How about this one from Joe Schmo? Can a Belgian, what the hell is that? Malinois be a house pet with normal obedience training starting from a puppy?
I think so.
Malinois.
I know there's breeds that in their genetics and in their lineage are bred for certain tasks, and Belgian Malinois are they're protectors. A lot of the police dogs are Belgian Malinois, German Shepherds too.
Oh yeah.
But I personally do think that it's the nature versus nurture debate. How much is nature, meaning how much is in their genes and you're not going to change it, versus nurture, how much is in their upbringing. And I think it's much more nurture than nature, to be honest. So I think they could be a house pet. Now I'd say that with that education of the owner, that hey, this is a breed that's usually known for being protective, and they're a bit of a guard dog kind of situation. So you do want to focus intently on just if you see those tendencies, that just to be careful. But yeah, I think that they can be good house pets.
There you have it.
In the right hands, Joe Schmo. Not that's what bothers me the most, is people that adopt dogs and the minute that you walk into the room and see them that it was just not the right breed. He's in the closet.
Who knows what he's doing now?
He might lie down in there. It's usually a little cooler in there. He likes to.
He's got to somehow turn around, though.
I know, it's kind of a small.
There's nothing for him to sniff at. Actually, behind him, what he's sniffing now, that's the cheese head from Sharon Bottoms.
Oh yeah, it is.
From
Don't
Wisconsin.
eat that, Bob. It's not real cheese. Hi, handsome. So yeah, I was saying, you can tell when it's just a bad match with a breed and an owner, and you want to be as honest as you can without discouraging them. But there's times when I've really just wondered if a person did any research prior to adopting the breed that they got.
Wait, did the microphone pick up Bubba's burp just then?
Oh yeah, that was a good one.
That was a good one.
Hi, buddy.
You meatball.
Why don't you take a nap?
Heather thanks you, by the way.
You're welcome, Heather.
I was actually, and I just asked that poll question to see if Heather was still in the live chat. She is.
Heather's here.
Okay, so we always get questions about diet and dog food. So here's a couple, just even if you answered this before, Mara, let's just do it again, okay? Christy Cochran, what brand of dog food would you recommend for a large adult dog? Everything claims to be the best for dogs, but what really is the best formula? And then Kathy Tag asks, is Science Diet a safe food brand? The reports from time to time with some problems, asking for a Springer that's 12 years old.
Yeah. And as far as foods go, there are vets that are very specific. You need to feed this kind of food. Anything else that you're giving is, toxic or harmful to your dog. And I'm not one of those people. I understand that people have different dietary tendencies, whether you're vegan, vegetarian, eat McDonald's every day.
Keto,
I don't make judgments on that. I'm not, and neither am I saying that you should feed your dog McDonald's every day. So for me, the food should meet AAFCO standards, which is AAFCO. And most foods do that if they're sold at a pet store. Versus I'm surprised Walmart hasn't contacted me, because last time I said, versus something that's sold at Walmart. But yeah, if
entertainment purposes only.
Exactly. Folks. If you're buying it at a pet store, it's going to be a food that's met AAFCO standards. Some of my favorite brands are the higher end Purinas like ProPlan. I do like Science Diet. I have no issue with Science Diet. I know that they get a bad rap every so often for having certain chemicals, but they're, I'm not going to go too technical on that, but yes, I do like Science Diet. And I think that Hills, the manufacturer, has done a lot of good for animals in general and the veterinary community with their lines of prescription diets. And a company that puts that much focus on finding dietary, not cures, but ways to manage medical conditions with diet. I put my trust and faith in. So yes, I like Science Diet. On that same note, Purina does have good veterinary products as well, which is why I do recommend the higher Purina brands. Iams, Eukanuba, Natural Balance.
What about that Blue Diamond one?
There's Blue Buffalo.
That's it.
I have a little, but my only thing with Blue Buffalo is they seem to be very high in calories. I've had dogs that,
and it's tiny
no,
kibble, isn't it?
Yes, and some they have different sizes, but I've had some dogs where we were trying to work on their weight forever and a day, and eventually just looking at the calorie content on some of the Blue Buffalo is like, oh my gosh, they would eat half of the amount that they could eat of a different food if you looked at the calories. So
there goes that sponsorship.
Well, yeah, sorry, Blue Buffalo. And I'm not saying you shouldn't feed that. It just the amount that you feed is probably going to be less than you could give of another brand. I did go on a little rant about gluten-free last time as well. Most dogs, unless your dog has been diagnosed with a gluten sensitivity by your veterinarian, your dog does not need a gluten-free diet. Cats as well. That it's actually been proven or shown to really be I'm not going to say proven. Dogs that were eating gluten-free diets were having certain heart conditions at a higher rate. So there's still studies or, investigating going on into that. But the cardiologist I work with has certainly bought into or, believes in that. And your dog does not need gluten-free unless it has been diagnosed with a gluten sensitivity. Did I answer that question thoroughly? Yeah. For your large breed dog, the size of the kibble is one of the main differences between your large breed versus your small or toy breed. When they're puppies, that's where you do actually want to get a little focused on you do want to use a large breed puppy formula if you have a dog that's going to be 50, 60 pounds or above. And the reason for that is their rate of growth is important. The amount of protein and calcium in the larger breed puppy foods is regulated, so they are less likely to have growing pains. I'm doing air quotes because there is the medical term for it, but larger breed dogs and giant breeds especially can have growing pains much more consistently if they're not fed a large breed puppy formula. So otherwise, once they're an adult, the distinction is a little less. It's mainly the size of the kibble for the most part.
Mm-hmm. Good. Nice answer. All right, moving on. We have this one from Maggie G. Our 2-year-old Frenchton.
Frenchie and
Max, our 2-year-old Frenchton.
What's the con? I'm curious. Bichon, maybe?
I don't know.
Boston, Frenchie and a Boston Terrier. Oh, I gotta see. Oh, that'd be cute. A French Terrier and a Boston Terrier?
I don't know.
Huh.
Oh, anyway, our 2-year-old Frenchton, Max, has a wonderful disposition. But a couple of months ago, he started biting and being aggressive with 2 different nail groomers. One lady was his regular groomer. Since he was a pup, he was always cooperative. Then suddenly this. What happened and what's the solution, please?
Oh, that's tough, Maggie. Well, we talked a little bit about nail trimming last time as well. My big spiel on that, and obviously it doesn't really apply to Max, but is to, when they're very young, get them used to the paws being held. So, you're sitting together on the couch, just hold their paw. It's like you're holding hands with your loved one.
We don't do that.
I know we don't, but hold their paws, kind of squeeze their toes, touch between their toes. Because sometimes the only time a dog has its paws held is when they're going to have their nails trimmed. And it's not a pleasant thing to happen to them in most cases, because they're being held and they're having their, the clippers. It's not that it's painful, but when you pinch the nail, it's a little pressure on it. So yeah, get them used to their paws being held. So then the paw holding aspect of it isn't what increases their anxiety. I also mentioned leaving the clippers out or having them in a place where the dog sees them. So some dogs, the minute they see those clippers, their anxiety goes through the roof. So just those few things you can do when they're a puppy to try to get them, to see it as not such a bad thing. And then also, if you're doing the trimming, or if you take them somewhere to have them trimmed, do it more frequently and take less at a time when they're young. So there's less risk of going too far back to the quick, where it will hurt and it will bleed. So every couple of weeks, even having just the very tip of the nail taken off. And that usually they realize that, okay, this isn't such a big deal. I'm not saying this is what happened in your case, but it could be that the nail was cut too far, and that's where it turned into a not so pleasant thing. Just if it just wasn't the right day, if there were other dogs there that were barking, I'm again, not in any way trying to cast aspersions on where you took them, but something might have happened at the place that just wasn't pleasant for them. So just trying a new place, just to see. But I would tell the person that's doing it that Max has been a little bit standoffish, or, just give them the history. I think that's only fair. Because then if I knew in advance that this was something that was really stressful for a dog, or that they've reacted negatively, I would, go out of my way to just try to, sit with them for a little bit beforehand, give them a treat, just really try to, control any pre-anxiety that he might feel. And then maybe we would just do a couple nails at a time. It might be something where they only can do one paw. And honestly, it might be something where he needs some chemical help beforehand as well. And I'm not gonna, go into that, because that's something you should probably talk about with your own vet. But some dogs do require a little anti-anxiety medication before a procedure like that.
A gummy.
Exactly.
Oh.
Well, not exactly, actually. No, I'm not saying that dogs can take gummies. I can't even talk about it, but that would be an example of something that can calm a person down and be used for stressful situations. But again, not suggesting that for Max, or in this case, it's a very controversial area in veterinary medicine right now.
Is it? Yeah.
Oh yeah. I literally cannot even talk about it.
There you go.
Yeah.
So neither will I. All right. See anything here that jumps out at you? I mean, buddy, 19 said exclusively blue buffalo. You're still eating well, but has dementia. Got no complaints with the brand. Just don't overfeed.
That's fine, Ellen. Yeah, I agree. Just the calorie density is pretty high.
Yep. A couple of people asked about.
I like Purina One,
Purina, Marby,
Pro
and Crafty Lady.
Yep. Wait, can you go back up for a second? Oh, Crafty Lady. Her dog passed away, and they'd only fed him blue buffalo.
Yeah.
I'm sorry, that's young. I don't know that it was the blue buffalo. I'm not sure what happened with yours, but yeah, sorry to hear that.
Does this make sense?
Yeah, I'm sorry. I'm getting distracted by the chat. I'm not a huge fan of Bill Jack. Jean Martin.
That's a brand?
Yeah, it's a brand.
Jean, hi, good doctor. How about Bill Jack? Thank you for sharing your knowledge with us. Okay.
It just is it's kind of off to the side on something I would recommend. I'm not saying don't give it if your dog's doing fine on it. It's just not, I've never used it personally, but I think that's a little, lower end as far as the quality. God, I hope the makers of Bill Jack aren't watching. That's just my personal opinion.
Let's see. Okay. Thanks for that, Jean. Heather is back. Hi, Heather. Tony Stokes is in. Hi, Tony.
Hi, Tony.
Cheers, cheers, cheers. Anna Lee, what about filing the dog's nails?
Oh yeah, I had mentioned that last time too. So filing, if the dog really, if it's the touching of the paws that sets them off, then filing isn't necessarily going to be any easier. But if it's the clipping, then yeah, using a file instead. The negative there is it takes much longer, and it's not always better or more tolerated by the dog. But yeah, trying a file instead, depending on what's setting Max off. I'm not sure if it's the clippers or the restraint or what exactly is setting Max off in this particular case. But yeah, dogs that have an anxiety with nail trims, by all means, try a file instead.
All right, let's see what else we have out here tonight. Gloria, what's a good cat food for a senior cat that's a fussy eater?
Yeah.
He eats Fancy Feast. Any idea?
Yeah, I don't mind Fancy Feast. I think they have actually some really good canned foods that are very palatable for dogs and cats. Well, cats in this case. So yeah, the Fancy Feast, you can try different flavors. For some cats, their preference can change from canned food with gravy, like chunks with gravy, to more of a pate, which is, kind of a same consistency throughout it. So not chunks with gravy, but all kind of a moist food. So sometimes you just have to try different consistencies or kinds of the canned food, and then different flavors too. And honestly, gosh, the frustrating cases are ones where you find something that they eat and you say, oh my gosh, this is it. They love it. You go out and buy a bunch and then they don't eat it the minute you buy a whole case. So with some, they actually want variety. So, it's tough with fussy eaters, that's for sure.
I think our dog actually likes a variety.
And you do want to be a little careful with suddenly changing foods, because some animals don't tolerate a sudden change from one type of can to another. But if they're not eating at all and you need to get them to eat, that's often a risk you take. But in general, if you're trying to switch foods, we would say to mix together and not do a sudden, one to another drastic kind of change.
All righty. Thanks for that. Tony Stokes asks, if you're taking questions, and we are, my 4-year-old male cat prefers to do his business on my carpet instead of the litter. He scratches the litter box instead of the litter. Well,
one thing I've suggested in cases like this, so he's obviously showing a preference for carpet. So when you're talking about litter box issues in cats, there's you try to attract them to the box, and then you try to divert them from where they're going that's outside of the box. So in this case, since he's obviously liking carpet, you could think about actually putting a piece of carpet, if you have extra remnant or that, in the litter box. Now that you don't want to then make him think that it's okay to urinate on carpet. But if he really just prefers that, using it as your substrate in the litter box, even temporarily, might draw him back to it. Again, you can say, she's crazy, I'm not going to do that. I totally understand. But he's given you an idea of what he wants to urinate on. So that's the only reason I'm saying, you could actually use that in the box.
No, Tony's saying that his mom was feral and did not teach him to use the litter.
Right. So then also just trying different kinds of litter. Some cats don't like the sand or the small gravel. They want a larger, a pellet kind of litter. There's a product called Yesterday's News, which is a larger pellet that is made out of recycled newspapers. So yeah, just trying different litters. The reason I said use the carpet is because he's shown that he wants to go on that. But again, then I don't want your whole carpet area to turn into a giant litter box. So, but yeah, trying different litters. It could be a kind of like a crate training in a dog, where you have to keep him in a fairly confined area that does not have carpet anywhere except inside the litter box. So then he starts to go in the litter box, and when he's doing well with that, then you give him more space, and eventually allow him out on the carpet, or back to the place that has the carpet. So that's attracting him to the box. And then as far as diverting him from where he's going, that's outside of the box. Often the odor is there, especially if it's one spot that they're always going back to, the odor can be there even if you don't notice it. It can get into the subfloor. It can really seep into the padding of the carpet. So using really good odor neutralizers. So Nature's Miracle is a nice brand for that. Just really steam cleaning and deep cleaning that carpet to get the smell out. Especially if it's one particular spot. That's very important because sometimes it's just a fact of the smell still being there, up to and including replacing the carpet. But you don't want to go to that expense unless you know for sure, of course, that he's going to stop urinating on it. So yeah, taking his attention away from where he's going and then attracting him back to the litter box, and not an easy proposition in this case, since, most cats do learn young that the litter is where they're supposed to go, but he didn't have that in this case.
What about Pretty Litter?
Pretty Litter.
I don't know. She asked as a brand. Is Pretty Litter good? They advertise it a lot.
Particular brand. I don't know that particular brand, Tony. I did hear about a product called Cat Attract, 2 words. That was they do make an actual litter or a product that you can put into their litter to then try to get them to use it. I think a client told me about that and they had a good experience with it. So I don't know Pretty Kitty though. I think that was the.
Okay. Next question comes from Mary Keogh. Hi, Mary. My sister's Labradoodle is the Fanny Dooley of dogs. Loves carrots and broccoli, but hates celery and spinach. The broccoli makes him gassy, but it does that to people. Is broccoli bad for dogs?
No, it is not. Broccoli is perfectly fine for dogs, other than the symptom or the side effect that you mentioned, the gassiness. But it's fine otherwise. And it's actually really good. Someone, I think earlier in the chat, had asked about weight loss. I think it was Hannah, but and like green beans. So yeah, anything that creates fullness without calories is going to be helpful for weight loss. And so yeah, broccoli, green beans, all your veggies really, that are something they can crunch on and get the feel of eating and filling their stomach without calories. So yeah, all in on broccoli if you can deal with the gassiness.
Good. All right. This question comes from Maria Rodriguez. We love Maria. What's up with the increased number of dogs getting cancer? 2 of my boys had cancer and passed away. They were in pain, so I put them to sleep, so no suffering. I'm fortunate I'm a cancer survivor myself. Yeah. So have you seen an increase in just cancer diagnoses?
I honestly had this discussion with some friends not long ago, because in our group of friends, yes, there have been a fair number of young dogs. Including ours, yeah. And even younger, like Maria's dogs. So, 4-year-olds, 5-year-olds, just no good reason for these animals to be getting cancer that young. And, there are certainly breeds that are genetically more prone to certain cancers. But 4 or 5 is still just far too young in my mind. And, that's where we need a good epidemiologist to come in and study these populations of, if there are clusters of animals that are passing away young in certain communities, and is there a cause for it? I don't really have, just thinking of it in our group of friends that I just mentioned, I don't have a, something that connects those dogs, other than they live here. So is it the water supply? Is it something in the environment here? I can't narrow it down, but certainly giving bottled water just to eliminate that factor, getting regular checkups so things can be caught early. Not that would have, not in any way saying that would have saved your dog, Marie. I'm not implicating that, or intimating that. But yeah, regular checkups, and especially as they're getting older. So depending on the breed, as I mentioned earlier, the toy breeds, small breeds tend to have longer life expectancies than giant breeds. So, a senior dog for a toy breed is a little older than a senior dog for a giant breed, but incorporating regular blood testing into your annual exams for your cats and dogs as they're getting towards their senior category. That's something you can talk about with your own vet. But sometimes we can pick up on things in a blood test. Not that we're not doing marker tests or anything like that, but if there's maybe a low red cell count or a high white cell count or something that shouldn't necessarily be there, it might spur further investigation and we can catch something before they're more sick. But yeah, I agree, Maria. I feel like in general, cancer is increasing, not just in the animal population. And I don't have an answer for it. I mean, you hear all the time the different things that'll cause cancer. And
right.
I feel like walking out the door is a risk factor at this point, but
you could be onto something. Okay. Well, thanks for the question, Maria. That's a tough one, but we do what we can here. Let's see.
Oh, and yet scroll back up for a sec. Crafty lady, you said you buy your dog food at Petco. If they don't like it, it can be returned. That, yeah, definitely. Some grocery stores will do that too, to be honest. But you're much more likely to be able to return your food if it's bought at a pet store or if it's a prescription diet bought at your vet's. I know, like, even the online, like Chewy will take foods back if your pet will not eat them, or if they don't do well on them, they start having problems. Yeah, keep those receipts because you can return most foods. And it's actually from the manufacturer that's happening. It's not necessarily Petco. The manufacturer usually will reimburse even the store that's selling the food because they understand that not all dogs or cats will eat every food that the owner buys.
All right. How about this one from Lizelle? What types of treats do you recommend for dogs? What treats should they stay away from? A lot of people have mentioned that they freeze green beans and give those to their dogs.
Yeah. And of course, we give Bubba all sorts of, we talked about carrots, potatoes, anything.
Love sweet potatoes and apples.
But yeah, as far as the treat, gosh, I think there's so many options there. It's kind of like what I was saying before with foods. I think there's a lot of, really good treat options. Those same brands that I had mentioned earlier, or if people shared brands that they liked, most of those brands will make treats as well. So, if it's a treat that's made by the Purina or the foods I mentioned earlier, the Natural Balance, the IAMS, Eukanuba, Science Diet, they'll have good treats. As far as there's controversial topic with rawhides and bully sticks and those kind of things, pig's ears, etc. So those types of treats can cause problems for certain dogs. Rawhides can sometimes be upsetting the stomach, pig's ears as well. You do have to be a little cautious when giving those for the first time. So I also say, if your dog is the kind who chews something down to a small size and then is going to try to swallow that, but it's still got some size to it, there is a choking risk with some of these treats. I mean the rawhides and the pig's ears, not a dog treat, but small risk there too. So just watch your dog's stomach with any treat. Like when you're introducing a food, if you're trying to introduce a treat, introduce it slowly. Don't give them 5 in one day, and just watch for any digestive issues or just not so good reactions to it.
There you go. Okay, next question. How about this suggestion from Nanette Hodge? Great show, Corey and Dr. Meredith. Would you consider calling your show straight from the vet's mouth?
Much love. We'll take suggestions.
We'll never know. Yeah, at some point we'll have like a regular time slot, so it might be easier for folks to follow. But
yeah,
so far so good, man.
Yeah, and I wanted tonight to try to get through.
We'll get
all
there.
The extra. We're getting close, but there was one go up a little bit.
Are you sure?
Yeah, we missed something. Oh yeah, pesticides on lawns, Amanda. I wonder about that too. Most of the pesticides, they'll say that as soon as they're dry, they're less likely to, cause a problem if your dog were to eat the grass. But who knows? I don't know if I buy that all the time. But as far as like toxin from pesticides on the lawn, I think that the toxicity side of it does decrease or stop once it's dry. But is it, is that a source of problems? And then there was another one. Tony talked about your greyhound. And then actually, So Tony's talking about her greyhounds, that one had the left leg amputated. I'm glad she's doing well. And then your other greyhound had cancer too. So yeah, it's greyhounds are a breed that's very known to have bone cancers. I don't want to do a list of, breeds that get cancers. That's a little, I don't want to alarm
Macabre.
people. But yeah, bone cancer in greyhounds is certainly a known thing. So I always, I try to educate owners with certain breeds when I see them for the first time, or if they're a puppy. Hey, if this happens with your dog at some point in their lifetime, I'd be a little more inclined to take an x-ray sooner. And if a greyhound came in with a limp, I'm much more likely to want to x-ray that dog than say it's they just sprained something. Let's just try a pain reliever. And then Heather had another question too.
Let's see. Yeah, this one person keeps hogging the live chat. Heather Atwood asked, have you talked about the Lyme vaccine yet? What do you think of this? Ruby is taking Simparica.
Yeah.
But I wonder about the vaccine.
Yeah, we did talk a little bit about vaccines pretty early. I think that might have been our first question, or first early in the show. And Lyme is definitely a lifestyle vaccine. So what I would consider your lifestyle vaccines would be Lyme and leptospirosis, which we already talked about, and then your influenza and kennel cough vaccine. Stop it. Don't do that, Paul.
Wait, what?
Don't be mean to Heather.
That's just what people are asking.
So no, she's not, because she's asking good questions that apply to other pets too.
Oh.
So those would be your lifestyle vaccines, where I'd say, okay, does your dog go out in the woods? Are they getting a lot of ticks even though they're on tick prevention? Then yes, let's do the Lyme vaccine in that case. But a dog that lives without ticks anywhere in their environment, we're not going to even discuss the Lyme vaccine. So, and Corey's being mean to Heather. So.
Say so. What? Did you answer?
I did.
Oh, you're already done?
As far as Ruby goes, Heather, I'm not sure. Yeah. Oh, wait, I will say this too, though. The best way to prevent Lyme is to use tick prevention. So I would never just give a Lyme vaccine and then say, oh, yep, they can have ticks. No big deal. You want to keep ticks off of the body. That's your way to stop Lyme, because there are other tick infections for which we don't have vaccines. So if you're not finding ticks and she's doing well just with Simparica or with a tick prevention, then I wouldn't necessarily jump on a Lyme vaccine. But if ticks are an issue, or if she's out in the woods a lot, then by all means, yeah, a Lyme vaccine becomes a consideration. And no, you're not hogging the chat. Corey's just being his usual.
He's being Corey.
Sarcastic self.
Tony says it would be fun if Dr. Meredith, if he did a collaboration with Mark Ath. His YouTube channel is Spirit Whisperer. He does a collaboration with Debbie, Freebird Spirit, Mondays at 2. So there's that.
So I wonder if he's like a dog or can communicate.
I have no idea.
Yeah. We've had clients who have told us about their communicator, and their communicator felt that their pet was having an issue for this reason. And yeah, it's
a thing.
It's interesting. I mean, I think I can tell when Bubba doesn't feel great.
Sure.
So
Giselle asks, do you feel most pets are aware and accepting when they come in to be euthanized? That's a tough one.
That is a tough one.
People are defending Heather Atwood, by the way.
Good. They should be, because you're being mean to her. So aware, I think that's hard. If it's something that's been a really chronic illness with pain involved, then yeah, I think there is kind of almost a peacefulness that they'll feel. I don't want to anthropomorphize or jump into a dog or cat's brain either, but I do think in some cases, yes, if it's a chronic type of illness, if it's something more sudden where it's just kind of a traumatic or more sudden thing, then maybe not. But I have seen that in some dogs and cats where I feel like they almost are feeling at peace or know that their pain's going to go away. Does that make sense?
Well, I think there's a point where they're just like, I'm done.
See, Heather said, I am the smart and the nice one.
That makes Heather your viewer of the night.
Mhm.
How about this one from Jan Breck? Hi from, oh, she's down under. Hi, Jan. My dog is having trouble with his ears. What is the best solution? Cut out red meats and clean with.
Huh. Well, and
Thanks, Janelle.
I mean, certainly ear issues can happen as a result of a food allergy. So that is a possibility, but to jump to it being red meats, that's kind of it is a trial and error. So if you feel like there's something that he's eaten in close proximity to when the ears start to bother him, then by all means take that out of the diet and see. It really is all trial and error in that regard. For cleansers, it's kind of beyond my licensing to get into like specific cleansers. For grooming reasons, then certainly, well, I'm going to put it this way. What you want to look for in a cleanser for a dog's ear is that it has a drying agent in addition to a cleansing agent. The drying agent is important because you don't want to just put moisture in the ears and then have it sit there. So just look for something that says it will help dry the ears out. And in your dog's case, if the ears are red and irritated, something that is soothing to the ears. But as far as like a specific cleanser, that gets a little close to making prescription or making medical recommendations. So I'm going to shy away on that a little bit, but something with a drying agent and then something that would be soothing to the ears.
Good.
And honestly, if it's just a really uncomfortable and he's shaking his head a lot and there's an odor or a problem, then he might need actual medication for his ears. So I would take him in if he's in that category.
All right, here's a question from Wildflowers and Songbirds. Can a dog who has had a heat rash, this is a German Shepherd Husky mix, and pulled out all of her hair about a 6-inch circle, then healed with talc from the vet, get it back again?
Yeah. So what you're describing sounds like, we call it the kind of non-medical term, colloquial term is a hotspot, which is an area on the skin that'll get really irritated, sometimes infected, and it's often secondary to the dog actually licking or scratching itself. And that can be stimulated by allergies as well. Sometimes it's something that got onto the skin in that particular area, in which case it's a, kind of a one-time thing. That's usually fairly obvious. I know one of our dogs got a hot spot from a flea and tick medication I put on him. So we just never used that product again. But as far as coming back, stress can definitely affect a dog's immune system and capability of fighting off inflammation and infections. So yeah, that stress of, you had mentioned vacation. So if that, caused some stress for your dog, by all means, that can affect the immune system's ability to keep the skin healthy, but it could also make a dog lick or scratch themselves kind of in a behavioral way, where they get stressed, and like a person that bites their fingernails, they react to that by scratching and licking themselves maybe. So then that could create an issue with the skin. So yeah, definitely. Or it could be unrelated to the stress and that there's an allergy that's stimulating it too. So interesting to see if there's a pattern. In any case like this, I would always just say to just kind of keep a journal or just a mental log of the skin issue happened at this time of year. So whether it's spring, summer, fall, the season that you're in, and then these things were happening in the house, they were eating this type of food and having this type of treat. Because then if we can trace or, match that to something that is happening every time their skin bothers them, you're pushing my chair back. Then that helps us with diagnosing why it's happening.
Heather brought up this for animal skin testing.
Silvadine or sulfadine. Yeah, we have a product called Silvadine, which is a silver sulfadiazine. If it's something similar to that, I'm not going to make a broad recommendation on that, just because, of course, every hotspot can be different. But Silvadine or silver sulfadiazine it has some antibacterial properties and can be soothing on a hotspot. Yes, but I'm not, that would be something to not broadly say, go ahead. I would consult someone first before using that.
Michael asked about animals on plant-based foods.
Sure. There are actually vegetarian dog foods where, sometimes it's the protein in a food that can stimulate a dog's food allergies. So I have used vegetarian foods for dogs, not for cats. Cats they don't make taurine, which is an amino acid that they need inside the body. And that needs to come from animal meat for cat foods for the most part, or you have to give it as a supplement. So cats shouldn't, in my mind, should not be vegetarians. Dogs can certainly be, but I would, have it be for a medical reason, not just to give a vegetarian diet. If you're a vegetarian and want to give your dog foods that have no meat in them, that should be okay. But again, talk with your veterinarian about it.
Good. Top of the hour, Mare.
Did we finish all the questions?
We finished all the printed questions. We did.
Oh, that's great. I wanted to make sure we got through all those.
Yeah.
Are you sure?
Yeah.
I feel like there were some that we didn't answer.
Yeah, we got them.
Okay. All right.
Unless you have the skunk remedy.
Oh, yeah. Well, yeah. I knew there were some here. So these questions came from the
previous
session. Before our last session. I'm gonna take it. Before our last session, Corey did a live chat where people submitted questions, and we only got to about half of them last time. So I really wanted to make sure we got through the rest of them today, because I just wanted to be complete.
Right here.
I know, I'm just making sure. Okay, so yeah, there's one last question. I think we did get to everything else from what I can tell. If you submitted a question and we didn't answer it, by all means, submit it again here in the live, or send it to Corey on another message and we can address it next time. But Bonnie Joe said she lives by a canal. We have a skunk visiting. Her dachshunds got sprayed once. What do I suggest for the smell? And honestly, the best thing for skunk odor is, it would actually be a product that you would buy at the store. I'm a huge Nature's Miracle fan. I think they make some really good products, but they do have a skunk odor removal shampoo that you would put on. The big thing with skunks, if your dog gets sprayed, most of the time it's going to be in their face, because your dog was very curious about this little thing that was walking around, and that little thing got spooked and decided to spray it. So it's almost, well, not almost always, but more often than not in their face. So step number one is to not let them in your house, because what they're going to do is run in the house and start rubbing their wherever they got sprayed. They're going to rub it all over the couch and the rug and the furniture. And then it's actually not necessarily the dog that you're smelling. It's what they left on the surroundings. So don't let them come in the house. If you can find a way to then bathe them outside, that would be the best thing to do. But if that's not possible, obviously, I know if you don't have a hose or it's cold or whatever, just try to use a soaked towel, get their fur wet, use the shampoo on them, and then rinse it off as best you can outside before they come in, and then go straight to the bath. So you're trying to keep the oil or what the skunk has sprayed onto your dog from getting all around your house. But it's going to take time. It's going to take multiple baths. It'll be much better if you can keep it from getting on your furniture and in your house. So on your clothes as well. So it's going to get on your own clothing when you bathe your dog. You're better off. Don't bring that clothing inside, throw it away. Just don't even try to wash it. But it'll linger for weeks, if not longer. If you don't have a shampoo at home, you can do a quick Google. There's lots of formulas for, it's usually a combination of hydrogen peroxide, dish soap, and baking soda. I don't know the exact, I had it written down, but Corey tossed it. So yeah, a combination of those three things together can help, but your best bet is a commercial product. And then you do have to be careful about their eyes. That's the last thing I want to mention. If that oil gets in their eyes, it actually can be problematic for a dog's cornea or the surface of the eye. So you might need to use a saline rinse and rinse their eyes out as well. if you know it was a direct hit to the face, and that could just be a contact solution or just a saline solution. But yeah, it's watch their eyes as well if they got sprayed in the face. And then these products, you want to be careful about them getting around the dogs. You don't want to get the products into their eyes either. So if it is a direct hit around the face, that's where the wet towel works best versus putting the shampoo. You want to spot treat when you're anywhere near their eyes. So a lot about skunks, but that actually happens a lot. And I know there was I know people will use tomato juice as well, but I actually, thankfully, knock on something, we've never dealt with this in one of our dogs, but from other people that have tried tomato juice, they said it didn't really work very well. Not that you can't try it, but your peroxide, dish soap, baking soda mixture is definitely better for a home remedy. It does need to be rinsed off. You don't want peroxide on the skin for too long. But you can do a Google on that. And
that's exactly what Tony uses.
Yeah. There's really good Google, Google will give you the ratios on that. So.
Liz L earlier asked about a rattlesnake vaccine.
Oh my God, I'm sweating. Yeah, when I practiced in LA, we actually saw a lot of rattlesnake bites. Oh, scary, those poor dogs. And there was a vaccine. It's been 12 years now. So yes, there is a rattlesnake vaccine, but I really don't know much about it at this point, as if it's even still marketed. But if you live in an area with rattlesnakes, just ask your vet. It's just, I think it's priming their immune system to not have the severe reaction to the snake venom. Cause yeah, rattlesnake or not any, but the poisonous snake bites in dogs. Oh, such a scary thing to see. Really feel bad for these dogs. Usually they got them defending, I use these terms, not usually, but often they get them defending their owner. They see the snake, the owner doesn't, and the dog goes for the snake to protect the owner, and then they take the worst of it. Scary stuff.
All right, let's wrap it up, Mare.
Okay.
So hey, that was great. Thanks for all the questions, everyone. I think the good Dr. Lockwood and I are going to be away next week.
Don't think we are going to.
We are going to be away, but we're not going to be able to do a show.
No, but we do have Bubba's 10th birthday coming up.
We do.
Bubba's 10th birthday is August 5th, which we can't celebrate it that day because we actually have other plans, but we might do a show to celebrate Bubba's birthday, and probably it would be August 4th if we did. I'm more into this idea than Corey, but I want to do a show for Bubba's birthday.
So there you have it, folks. So we'll let you know when that is. We think Thursday, August 4th will be the next show. I'll come on and do a live question gathering session once again. I mean, although we do get enough questions in the live to carry a full night there too. So thank you, Dr. Lockwood.
You're welcome.
So tomorrow night I'll be on, I'm guessing 7 p.m. Eastern time to take questions for Annette Dion, the psychic. And then Annette and I will be on live, I believe side by side live from the deck here at Bridge headquarters. Wednesday evening, 6:30 or 7 o'clock Eastern time. And then we're introducing a new Bridge member, new Bridge buddy, Linda Sabo, and she is a hypnotherapist. And so you'll see my interview with her, and then I'll be in that live chat afterwards. We'll do a premiere video for that one. And we'll see what your reaction is, and I'll engage with you. And then if we want to do a follow-up show with the hypnotherapist, and I think you will, we'll do that as well. So a busy week here on the channel. So thanks for all your support, all the thumbs up, all the subs are great. Thanks for all the comments. What do you have in here?
I like Annalie's title, Bubba's birthday bash.
Here you go.
Yes, you're all invited. We would do I want to do it. Just gather all of his favorite foods and just see, show you guys what he drools over. Can you hear him snoring right now? My God, snoring. He is snoring hard.
Yeah, he's sleeping, not napping now.
No, we can't get on him. But yeah, Bubba's birthday bash. I like that, Annalie.
So we'll have to figure out, you'll have to tell us when a good day of the week and time slot would be to do something more regular here. But we're still just sort of getting the wind under our sails here through the summer and feeling what the show is going to be like. And then Matt, my buddy, our tech guy, I'm actually going to be with him Wednesday afternoon to work on new stuff too, like set and all that kind of thing. We're going to have lunch, and then he may be back here. So anyway, there's a lot going on. So anyway, Thanks to everyone for spending the time with us tonight. Spread the word if you can, that this is actually out there and it's a thing. And we appreciate all the kind comments and questions.
Yes, thank you, everyone.
And we'll see you next time. Okay. Bye for now.